Hi, and thank you for taking the time to watch this. I'm Will, the Chief Executive Officer at Relative, and I want to walk you through what we do, how it works, and whether this might be a fit for you. I'm going to cover three things: what the treatment is, what this looks like for you as a nurse, and what to realistically expect both clinically and financially. And I want to be very clear from the beginning, this is not a get-rich-quick opportunity. It is not overnight success. This is a real clinical model and a real business. It requires effort, consistency, and ownership. But for the right person, it can be incredibly meaningful and create a completely different way of working in healthcare. Let's start with the treatment. Relative uses a model called neurofunctional pain management. This is a non-invasive, non-pharmaceutical approach to treating chronic pain. Patients enroll in an 8-week program, 2 visits per week, about 1 hour each, 16 total treatments. This is a structured therapy cycle, not a one-time visit. And what we see is that many patients experience meaningful reductions in pain over that time, often lasting for months. Each visit includes 3 components. First is electroanalgesic therapy, or EA therapy. This happens at every visit. This is different from a TENS unit. TENS stimulates muscle. EA therapy stimulates the nervous system. It works by helping inhibit pain signals and stimulating the release of neurotransmitters. Second is IV therapy, done once per week if appropriate. This includes B vitamins, amino acids, and glutathione. It supports recovery, but it is not required. It's important to remember that while you are an independent contractor, you are part of a much bigger whole. There is a massive amount of collaboration and overhead work happening behind the scenes to support your success. From medical oversight and billing to IT and marketing, you have a dedicated engine running in the background. This allows you to focus on what you do best, clinical care, while we handle the complexities of the infrastructure. As patients come out of pain, they're more open to change. You help guide movement, habits, and simple lifestyle shifts. We train you on this. You are not expected to come in as an expert. Now let's talk about what this looks like day to day. This is a mobile model. You go to the patient's home. You're working one-on-one for about an hour. No rushing, no juggling multiple patients. It's a very different pace of care. Patients complete the program, improve, and often return when needed. Over time, you build a panel of patients and referrals tend to grow. Now let's talk about how patients get to you. We support marketing and lead generation. That includes condition-specific outreach and general chronic pain leads. But this is important. You are not passively handed patients. You are part of the process. You'll talk to patients and help guide them through physician orders. Now let's talk about income. On average, nurses earn about $100 to $150 per treatment. So roughly part-time, around 6 patients is about $6,000 a month. Full-time, around 12 patients is about $12,000 plus per month. This varies based on consistency and location, and you are working as an independent contractor, which means this is not a traditional job. You are operating as your own business. You control your schedule, your growth, and your level of involvement. Now let's talk about the investment. There is equipment required, about $30,000. Most nurses finance this, and we have resources to help. But I want to reframe this clearly. You are not just buying equipment. You are investing in a mobile medical practice and a new way of working, and a treatment that actually helps people. We are seeing patients reduce or eliminate pain, improve mobility, and improve overall quality of life. This is meaningful work. Now, expectations, this is not overnight success. Some people build quickly, others take a few months. The difference is consistency. And you are not alone. You'll have support from a medical director, education team, operations, HR, billing, and IT. We guide you through everything. So as you're listening, ask yourself, do I want more autonomy? Do I want more meaningful patient care? Do I want to build something of my own? And am I willing to put in the effort to do that? If the answer is even a maybe, the next step is to schedule a call. We'll walk through your situation. No pressure, just clarity. I'd truly love to meet you and hear what you're looking for. Thank you for your time, and I look forward to connecting with you.